Hello, my name is Christine. So today we're going to be talking about a pretty controversial topic within the world of parenting and even outside the world of parenting, and that topic is extended breastfeeding. So in other words, it's breastfeeding past age 1, and typically it's letting the child choose to self-wean, which can be anywhere from age 4 and sometimes not even until age 7. So we'll examine the stigma surrounding it, why there's stigma, and how the stigma affects these nursing mothers. Then we'll discuss the consequences that early weaning can have and the benefits that both mother and child can miss out on. Finally, we'll examine a possible source of support for these nursing mothers who choose to do extended breastfeeding, a source which can also help to change the general public's view on extended breastfeeding. So let's get right into it. So here's a picture that probably many of you have seen already, and you might have different feelings about it. So this is the cover of the May 2012 issue of Time magazine, and it actually caused quite a stir. So the mother is then 26-year-old Jamie Lynn Grumit, and her son, who was 3 at the time, and obviously he was still nursing then. So the cover offended many people, even prompting some to state that nursing a child of that age is sexual abuse. So we'll get back to the negative reactions about some people have of extended breastfeeding, but let's spend a moment talking about some statistics on breastfeeding. So, some statistics on breastfeeding. In 2016, about 80% of mothers began breastfeeding at birth, so they began breastfeeding their newborn babies. 6 months later, the number had dropped to 52%, and by the time these babies were age 1, only 30% were still breastfeeding. So it's possible that some of these numbers drop due to issues with breastfeeding, latch issues, or milk supply problems. Some mothers may also be going through medical issues that make breastfeeding impossible to continue because a lot of medications you can't take while you're nursing because it passes through into the milk. For many of the mothers, however, they stop nursing because the pressure from society is too much. They can't fathom the idea of breastfeeding their child longer than what's the norm here in the United States. And the norm is age 1, you stop breastfeeding. So the stigma against extended breastfeeding. So 44% of mothers who choose to breastfeed their children past age 1 experience negative reactions and comments. That number jumps to about 61% for mothers breastfeeding past age 2. And these comments can come from friends, family members, or even complete strangers. They're often said while the mother is nursing, in the act of nursing, so obviously within earshot of the child. Older children can obviously understand what is being said, and comments can be anything from, "Oh, isn't she too old for that?" or "That's so wrong, you're going to harm your child," or even, in extreme cases, "That's child abuse, I'm calling CPS." And accusations of child abuse have been thrown against nursing mothers and have actually even resulted in children being temporarily removed from their homes in the past. So let's look at these two pictures. What's the difference between these pictures? We've got two mothers, and they're both nursing their children. So the difference is that the mother on the left, the white mother here, is nursing her toddler, and she's probably heard some negative comments about it. "Oh, that she's too old for it, you need to stop," and been made to feel that what she's doing is extreme and odd. The mother on the right, the African mother here, she's probably hasn't had any negative comments. She probably hasn't had anybody tell her that what she's doing is wrong or that she should stop. She probably hasn't even had anybody bat an eye upon seeing her nurse her child. The United States is actually one of the few cultures that shames mothers practicing extended breastfeeding. So why is there stigma here in the United States? Well, part of the reason is that in the United States here, that breasts have become a sexual object. So you see this Victoria's Secret ad here, obviously showing off her breasts in this bra. And it's somewhat ironic because in this picture here, you can actually see more breast than you can often see when a mother is nursing her child, thanks to the design of nursing bras and tops, and the fact that the child's head often hides the breast from view, especially with an older child. And yet, close to 50% of people today have an issue with public breastfeeding, and they also believe that breastfeeding should not be shown on any television shows or in movies. That is just too inappropriate. Unfortunately, many people are unaware of the continued benefits of breastfeeding a child beyond the first year, and actually believe that cow's milk is a healthier option at that point, and that you're potentially damaging the child by continuing to nurse and not offering cow's milk. And finally, there is quite a push for early independence here in the United States, in contrast to many other cultures where they're more community-minded and they're less individualistic. So here, babies are expected to sleep alone in their room, in their crib, from day one. They should learn to put themselves to sleep by 6 months. So we have sleep training, which many other countries don't do because they co-sleep. And they also here, they're expected to walk, talk, and go to school as soon as possible. So preschool now is age 3. And extended breastfeeding is seen by many as a way of actually hindering a child's independence and keeping them too attached to the mother and preventing separation from the mother. Okay, so facing all of this stigma can lead many nursing mothers to do one of two options. So the first is that they can simply wean their child. And with pressures from family, friends, and society, it's not a surprise that a lot of mothers do choose to wean early. And this could be at age 1 or even earlier. And why is this a problem? Well, it's because the World Health Organization actually recommends mothers to nurse for at least 2 years and beyond if both mother and child desire it. And as we'll talk about in the next slide, breastfeeding beyond age 1 continues to provide many health benefits for mother and child. Now, the second option that mothers are faced with, due to the stigma surrounding extended breastfeeding, is that they can do what's been termed closet nursing. So this is when mothers basically decide to keep nursing, but to keep it a secret. So they may not discuss it with their doctor, or their child's doctor, or their friends, or even extended family who may have negative views on it. And they may avoid nursing in public to avoid comments and stares from strangers. So this is a big problem because it means mothers end up with a lack of support as they continue to breastfeed. And breastfeeding can be difficult, so any support that mothers can have, they need. So to be breastfeeding without support is very difficult. So let's move on and let's talk about the benefits of breastfeeding past age 1. So breastfeeding past infancy lowers the risk of obesity, childhood leukemia, and allergies. And in the second year of nursing, the immunities in breast milk actually increase. So the longer you nurse and the older the child is, the more immunities are present in the milk. It continues to provide nutrients, especially protein and vitamins such as B12 and A, vitamin A. Breastfed toddlers get sick less, and when they do get sick, it's generally a shorter duration compared to toddlers who are not breastfeeding. Extended breastfeeding also contributes to higher IQ and better social development, including more secure independence. So previously we discussed how there's some stigma surrounding the idea that if you practice extended breastfeeding, that it'll mean your child can't be independent. But research actually shows that children who are practicing extended breastfeeding, they are more secure in their independence. And extended breastfeeding provides benefits to the mothers. So it reduces the risk of breast cancer, ovarian cancer, uterine cancer, endometrial cancer, osteoporosis, arthritis, and cardiovascular disease. And finally, it's a great way to bond with your child and soothe them when they're upset. So it can be a very useful parenting tool. If you're in the grocery store and your toddler is just about to have a meltdown, then you breastfeed and you can finish your grocery shopping and get through the line without a tantrum in the store, which any parent, I'm sure, would tell you would be a very nice thing. Okay, but what about the doctors? What do the doctors say? So, because of lack of education on breastfeeding, some medical professionals actually advise mothers to wean before they really should. So doctors may tell mothers that breast milk loses all its nutritional value beyond 1 year. Dentists may tell moms that nursing after the child gets teeth can cause misalignment or even decay. And other medical professionals may discuss how extended breastfeeding interferes with a child's ability to self-soothe or in gaining independence. None of this is true, and in fact, it's actually quite the opposite in cases. So, breast milk does continue to provide benefits for as long as it's continued, even up until the child's 7, 8. I mean, you could nurse up until adulthood and it would still provide benefits. Obviously, I'm not recommending that. People don't recommend that. But as long breast milk continues to have benefits, as long as it's there, it doesn't lose its benefits at any point. And the immunities in the breast milk actually increase the longer nursing continues. Research has not linked breastfeeding with tooth decay or misalignment. There's actually research that shows that there's a component in the breast milk that actually helps fight bacteria in the mouth. So it's actually possible that breast milk reduces the chance of cavities. And as far as independence, children who are breastfed beyond 1 year are often more secure in their independence, as we discussed before, than those who are weaned prematurely and forced into early independence. So the Leche League is an organization that supports breastfeeding mothers, including those who breastfeed their children past age 1. And some mothers practicing extended breastfeeding state that La Leche League meetings are one of the few places they actually feel comfortable nursing their older children without the risk of negative judgment. Unfortunately, while La Leche League is widely known within the breastfeeding community, many people who are not parents or who do not breastfeed their children or who don't know anybody with children who are breastfeeding, they don't know of its existence. So even though it's a great organization, their teachings and support don't really extend into the general public. So it's not very effective in reducing the stigma against extended breastfeeding. So how do we help reduce the stigma against extended breastfeeding, and how do we help these mothers get more support and less criticism? Well, one great option is to use the expertise and support of child life specialists. So child life specialists are extensively educated in child development, and they're usually seen as more personable and less medical than doctors. So this is good because they're seen as more approachable. They're also more educated in child development than lactation consultants, who aren't even required to have a license, and who may only have experience working with newborns, because they're often present to help with early breastfeeding and helping with latch issues, which if you're nursing a toddler, that's not really relevant to you anymore, in most cases. So families would likely feel more comfortable discussing their breastfeeding choices with a child life specialist rather than with a doctor or pediatrician, without the fear of being judged or told to stop. So ultimately, having these educated professionals provide support for extended breastfeeding will help to educate the general public and reduce the stigma against it, because they're still seen as educated and they're still seen as professional. So the general public will trust their word, and families who are practicing extended breastfeeding feel comfortable discussing it with these specialists. Now, my experience. So this is a picture of my little girl nursing. I'm a breastfeeding mother. My daughter she's almost 29 months old now, and she's still nursing, and I have no intention of stopping anytime soon. I'm going to let her decide when she's ready. So, as we've discussed, I personally have experienced some negative reactions, and surprisingly, it's mostly from people in my own family. So the comments started shortly before she turned 1. And they'd be things like, "Oh, you just give her formula or give her cow's milk now. She's too old for that. You need to stop. You can't breastfeed a 2-year-old, and oh, the milk's no good anymore." And I know these comments come from a place of ignorance mostly, as no one else in my family has breastfed, and they don't really understand the benefits or the relationship that develops between the mother and child during breastfeeding. They're simply going by what the norm is in society. And these comments don't faze me because I'm a pretty strong-minded, stubborn person, but I can definitely understand how they would affect somebody whose maybe their breastfeeding journey has been more of a struggle than mine was, because mine was pretty easy from the start. But somebody who's maybe already struggling with breastfeeding, maybe they're not quite sure about extended breastfeeding, and that pressure's on them from their family and friends to stop, and they're concerned with how others are going to view them, they might feel, okay, I better just stop. And they give in to what their friends and family want, and they give in to what society wants. And it may not be what they actually want. But it feels like their only option. So, in conclusion, the decision to breastfeed your child past infancy, or even beginning of infancy, it's a pretty deeply personal decision, because it takes a lot of sacrifice from the mother. It takes a lot of her time. It means that she's often the only one who can feed the child. And it is hard. It takes a lot of energy. But mothers who do choose to make this decision are providing health benefits for their child as long as they continue it. So they should not be subject to harsh criticisms or accusations of child abuse, and they should not be given false information by doctors who haven't received adequate education on extended breastfeeding. They should feel comfortable nursing their child in public, whether that child is a newborn or a 3-year-old or even a 6-year-old. And they should feel like they can do that without a stranger coming up to them and telling them and their child that what they're doing is gross or wrong or child abuse or anything like that. They need more support from their family, their friends, their doctors, their child's doctor, and from society in general. And child life specialists, as we discussed, can provide this support and educate the general public because of their demeanor, their education, and their experience working with families and children of all ages. So these are some pretty good resources for those who want to learn more about extended breastfeeding and its benefits, as well as how it's been viewed throughout history and the stigma now associated with it here in the United States.